Hello students, welcome to Ekam Academy. Today I am going to talk about an important issue that is in news related to health claim insurance. Basically, we all know that most of the rural India and also the urban India spend lot of money from their pocket. We call it out of pocket expenses. Lot of money is spent on health issues, out of pocket expenses. The biggest problem here is if for treating somebody in the family, if a heavy amount of money is spent out of expenses, it may result in the family going into the poverty line, going below the poverty line. So what happens is, with a view to ensure that the out of pocket expenses in the urban or the rural area is minimized, the government generally what you call encourages something known as health insurance. The government encourages what? Health insurance. What is the aim here? So that the out of pocket expenses for the health is not borne by the individual family and borne by the insurance company, for which the premium is paid by the family members. Okay? So in this particular direction, the government is now going to establish National Health Claim Exchange. We'll come back to this National Health Claim Exchange, what it is. But before that, try to understand that the Insurance Regulatory and Development Authority of India, it is the Insurance Regulatory and Development Authority of India. This basic entity is responsible for ensuring that the insurance sector is properly regulated. Okay, so this topic related to Insurance Regulation and Development Authority related to health, because this topic is related to health, this topic forms part of our GS2, where social sector, where health and related issues are given, especially in the mains examination. Now, what is the aim of this IRDA? The Insurance Regulatory and Development Authority of India, it has an objective. What is this objective? Of achieving insurance for all by 2047. See, this 2047 year is very important. So by 2047, the IRDA wants that every family in India, if they are not getting any support of the government related insurance, they should have a insurance coverage to cover their health expenses. Because we are talking related to insurance, we need to have a clear understanding of two topics related to insurance. One is insurance penetration, the other is insurance density, important from prelims perspective. What is this insurance penetration? It is measured as a percentage of total insurance premiums collected with respect to GDP of the country. It means if our GDP is 100 rupees, against the GDP, what is the amount of premium that has been collected with respect to GDP for various insurances? In India, it stands at 3.8 as per the Swiss Re. This is one of the agency that tries to measure the insurance penetration in our country. So according to this, the present insurance penetration in India is 3.8. If you are preparing for prelims, I am sure most of you would be aware, the world or the global average is 6.5%. It means comparatively, India is lagging behind the global performance when it comes to insurance penetration. Once again, insurance penetration is nothing but a measure of the percentage of total insurance premiums collected with respect to the GDP of the country. And what is insurance density? It is calculated as a ratio of total insurance premium collected. Here it is percentage, here it is volume collected to total population of the country. So what it says, only 2.9% of the population is covered under various insurance schemes, which is much less than the global average. So insurance density and insurance penetration. Now let's go further to the topic. Now, National Health Claim Exchange. What it is this? The National Health Claim Exchange will serve as a gateway for exchanging claims related information among various stakeholders. Whenever you want to take a health related insurance claims, we primarily have three entities. The first and the foremost is the Health Ministry, obviously, because this is the controlling agency. Second is the insurance company that is offering the plan, and thirdly is the IRDA, Insurance Regulatory and Development Authority of India. Now, all these three must be in sync with each other. So what this National Exchange is doing, National Health Claim Exchange is doing, the NHCX will serve as a gateway for exchanging claims related information among the various stakeholders in the healthcare and health insurance ecosystem. So whatever insurance claims that we are going to take would be available with the information related to this would be available with all these three stakeholders. What is the purpose? The purpose is basically to solve the clear the insurance claim as early as possible without any time delay, because we know generally in practice a lot of delay happens in the passing of the insurance claim by the insurance companies. Lot of issues between the hospitals and also the insurance companies that are giving claims. So the person at the end of the day, the customer runs from pillar to post to get his insurance claims settled. If we have an exchange of a sort, all the regulating entities are having the information at one place, better management can happen. So that is the reason why it is a very good reform that is being projected in the dimension of healthcare sector. Okay. Now, why is the NHCX being brought in? What is the purpose? What is the reason? It says there was a paper very recently written under the title Health Insurance Coverage in India, Insights for National Health Protection Scheme. What it says, it noted increase in the out-of-pocket expenditure which burdens the individual. I told you a lot of people spend money because health is an emergency situation. They cannot wait for a claim to be settled because the hospitals insist that the treatment cannot start without the money being paid well in advance. So most of the people end up paying money from their pocket and wait for the claim to be settled by the insurance company, which takes a lot of time. So this report found out that there is a substantial increase in the out-of-pocket expenses related to health. It points out that for all India, at India level, the hospitalization cases are highest when insured from private purchase. When the insurance package is purchased from a private player at 54.4% when we are seeing the India view. But when we are seeing the urban view, cases for inpatient care, that is hospitalization cases, are observed to be highest for those covered by government funded schemes, that is 60%. It means at India level it is private purchase, at urban level it is government funded schemes. But ironically, on the contrary, in rural areas, the inpatient cases, that is the hospitalization cases, are substantially higher for those purchasing private insurance cases. It means in rural India, somehow the government funded schemes are not able to reach, because most of the government employees by some reasons are concentrated more in the urban area. So all India private, urban government funded, and rural again private purchases. This you need to understand. Why is the NHXC being brought in? The NHCX will help in standardization of interoperability of very important health claims and will bring in seamless exchange of data, documents and images between whom, very important, payer. Here payer means not the insurance premium payer, the payer of the insurance claim. That is where the insurance company will come into play. The the provider, that is the hospital who is providing the service, and also the government which is in middle of the scheme. So that is how the NHCX will help in standardization of interoperability, where particular guidelines would be given to insurance companies within how many days the claim has to be settled. Particular guidelines would be given to the hospitals, labs or the polyclinics how to encourage payment based on insurance claims and not insisting on out-of-pocket expenses from the people. That's the idea here. What about the cashless claims, that is digital claims? It gives a timeline. A timeline has been fixed for insurance claims of cashless claims. The insurance authority has said that the cashless claims have to be processed within 3 hours of receipt of discharge authorization from the hospital. So what it says, the moment the hospital initiates the discharge procedures, the moment the discharge authorization letter is handed over by the inpatient person to the insurance company within 3 hours of the receipt of the discharge authorization, the claim has to be settled. This is a very big achievement if this can be made possible on ground. Okay, this is a very important point. Some of the other incentives on offer related to this scheme: to encourage adoption of digital health transactions and digitization of the patient health records in the country, the National Health Authority had announced financial incentives under the Digital Health Incentive Scheme from January 2023. I'll talk a little about this too also, National Health Authority and the Digital Health Incentive Scheme. Under the DHIS, there is a provision that for every insurance claim transaction through NHCX, financial incentive of rupees 500 per claim or 10% of the claim, whichever is lower, would be given to the hospitals. Though it is a financial incentive to the hospital also, 500 or 10% of the claim amount, whichever is lower. Very, very important from your prelims perspective. Okay. Now, what is this Digital Health Incentive Scheme? The DHIS was launched with effect from January 2023 under the umbrella program of Ayushman Bharat Digital Mission. What is this scheme? The scheme proved to be a significant catalyst in promoting the adoption of digital health technologies and practices in healthcare delivery across the country. So this scheme basically is trying to bring in digitization in the health sector. Under the DHIS, the eligible health facilities and digital solution companies shall be able to earn financial incentives of up to rupees 4 crores based on the number of digital health records created and linked to Ayushman Bharat health account numbers of the patients. So depending on the number of patients, see, understand, the idea here is to create a database, very, very important database of patients. So the hospitals, more the database they create, they can claim up to 4 crores of financial incentives. So this is how it is encouraging people to go digital when it comes to medical transactions. And what is this National Health Authority? It is the apex body responsible for implementing the Ayushman Bharat Pradhan Mantri Jan Arogya Yojana. Very, very important for prelims perspective. The National Health Authority, it is responsible. It is the apex body. It has been entrusted with the role of designing strategy, building technological infrastructure, and implementation of the National Digital Health Mission to create a national digital health ecosystem. Very important. Before this entity, National Health Authority, we had a successor, National Health Agency. So this was the previous agency, and this entity is the successor to this particular agency, which was functioning as a registered society since 2018. So the National Health Authority primarily replaced the National Health Agency. So this topic, as we have discussed today, is important in the GS2 health sector related issues and also few topics from the prelims perspective. So for more such videos on on topics like these related to UPSC and other state PCS exams, do like, share and subscribe to our channel. Thank you. Jai Hind.